So hip revision is a great surgery as long as there's an underlying cause for doing the revision. Typically that's where there is bone loss, the implants have loosened because of the way the bone changes around the implant. The plastic that used to be used as standard polyethylene has worn out, or the hip starts to dislocate because the plastic has worn out. And if you have one of those criteria, also infection is a very common reason for revision, then we go ahead and replace the parts that are worn out. Surgery, again, can vary anywhere from an hour to 3.5 hours, depending on the parts that have to be removed and changed. Hospital stays a little bit longer, usually again, around 3 days, sometimes 4 days, and recovery is a little bit longer. So therapy is, again, typically twice as long as for a primary hip surgery. Most hip replacements that were done have lasted around 15 to 20 years, so the people that are coming up for a revision primarily have had their hips done in the 90s. Again, the keys are to revise them for a known reason. So hip pain alone, without understanding why the pain is there, is not successful. So pain due to wear of the plastic, pain due to something loose, pain due to leg length discrepancy has very good results. And again, I recommend that hip revisions be done only by surgeons that have had some fellowship training. Again, you don't want to take a bad problem and turn it into an even bigger problem by having a surgeon that doesn't do these surgeries and hasn't had the specialty training. There's a lot in surgery where you learn from mentors and carry on those techniques and methods into your practice. And if you haven't seen it and haven't seen enough, then you're likely to make mistakes. I myself do about 100 revisions, both hip and knee, a year. In my fellowship, we probably did, between the different surgeons that I worked with, about 200. So I've hundreds of knee and hip revisions I've worked on. But more importantly, I continue to go to the conferences and lectures with surgeons all over the U.S. that specialize in hip and knee revisions. And I love to borrow ideas when new implants are available or clever ways of addressing removal of components. I'm very happy to take those ideas and incorporate them into my practice.